Hi, I'm Dr. Daria.
And I'm Dr. Michael, and welcome to
Health
HealthTalks.
Talks.
So what are we talking about today?
Well, we're going to talk about what happens to our brain during the menopause transition.
A lot of our patients are going through that.
Yes.
And there's a lot going on. So
Yes, there is
tell
a
us.
lot going on. So being of that age group, I can definitely relate, to the cognitive effects of the menopause transition. And I also, talk to a lot of my friends, and we're all kind of like all of a sudden going like, what, are we dumb? Like we could be talking about something and then all of a sudden like both look at each other and go, wait, what were we just talking about? So it's real.
Yep.
And it can be really disturbing. And I definitely think it warrants a discussion.
Absolutely. And there's an emotional component to this too?
For sure.
Yeah.
For sure. And I think, going through the menopause transition, we have so many different symptoms and so many different things are happening to our bodies that sometimes what we feel emotionally and cognitively really can be effect of a lot of things kind of snowballing on top of each other.
Well, that's my question. What is exactly happening?
So what
on?
is happening? So we see, cognitive decline in about 50% of women going through the menopause transition. And we see it in being able to recall, verbally, remembering words. It's a slower processing that we see. And this can really affect us emotionally, socially, and it can affect us at work. And sometimes, women can get embarrassed because where they used to be able to, really be quick on picking up things, all of a sudden they're saying, oh my gosh, this is taking me a lot longer to get through things. Sure. And trying to figure things out.
So it
and
sounds
remembering.
like there's a bit of a snowball effect going on here. So tell me about
There's
what's going on.
Absolute snowball effect. So during this time, women might feel a lot of different symptoms. One is hot flashes, and the hot flashes sometimes lead to sleep disturbances, which lead to sometimes we see weight gain around the perimenopausal time.
Absolutely.
And all these things kind of snowball on top of yourself. So if you're not sleeping well, you're not feeling well, you're kind of like, you don't remember as well also. So, one of those is what I call the snowball effect of the menopause transition is that all these things are occurring at time, and one thing leads to the next, to the next, to the next, and then you just have a lot of different issues.
Sure.
Also, we look at, when women are in their, late 40s to 50s, when that's most often when the menopause transition occurs, there's a lot of stuff going on then. A lot of times if you have children, the children are leaving for school, which brings its own sadness sometimes and difficulties. We know that because we have kids in college. And also aging parents. This is the time that maybe you're taking care of your family members are aging and putting a lot of time and effort into that. And sometimes it can be a really difficult time for women going through this.
Is there a physiologic effect going on? Anything about blood flow?
Yes, for sure. So our sex hormones, estrogen, progesterone, and testosterone, are all really important for brain function.
Okay.
There are certain areas of the brain that have receptors for these hormones, and these receptors can help, estrogen can help with these receptors increase blood flow to the brain and reduce inflammation.
Absolutely.
So and that kind of helps keep your brain healthy and working well. So we see during the menopausal transition where you have a kind of roller coaster of hormones and sometimes very low states and then higher. And then once we are in menopause, our estrogen is really low. And we see that can play a role in decreased cognition as well.
So does hormone replacement play a role in alleviating those symptoms as well?
Well, the data is kind of conflicting as far as how much of a benefit we see with hormone replacement therapy. There seems to be some benefit for cognition and menopausal women and women going through the transition. But definitely we see more benefits to those women that are started younger. So starting it around the time of menopause, it seems to have more benefit. Right now, there's really not an indication to go on hormone replacement therapy for cognitive benefits alone. But there can be people that do see an effect a positive effect to it who are maybe on it for other
So
reasons.
what else can we do to improve cognition during this period of time?
Well, there are some things we can do, thankfully.
Good.
Yes, that's like, making lifestyle choices, good lifestyle choices. I mean, certainly increasing your social network.
Yeah.
So keeping socially active, have a friend group that you do things, make sure you go to the party you're invited to.
Yeah.
Sometimes we get caught up in life and we don't make time for that, but that's super important for our brains, is to keep our friends and to go to the social events that we're invited to.
Yeah. If you see the symptoms worsening, what would you recommend somebody do about that?
If the symptoms are worsening or they don't seem to just be due to hormonal changes or age related, you definitely should see a doctor. You should see your primary care doc to do a workup, and maybe even seeing a neurologist, because I think that's important. It's an important thing that if things are worrisome, if your family members are getting worried or you're worried about somebody else, that it seems a little bit too much change, it's definitely time to get evaluated.
So just as an aside, I mean, I know a lot of medical doctors don't want to do this. They may get the hormone levels, and even a lot of OBGYNs don't really want to deal with hormone replacement.
Right.
I mean, you specialize in that.
Yes.
So what would you say to somebody if their primary doctor or their gynecologist really don't deal with hormone replacement? What do they do?
So you want to look for somebody that has a real interest in the menopausal practice. So you want to look, there's a National American Menopause Society that lists practitioners that have said, listen, I want to learn more about this, and this is how I want to base my practice.
This is your passion.
Yes, this is my passion.
You love helping peri and postmenopausal women feel normal again.
I do.
And I agree. That's what you're looking for. If you're experiencing these things, seek out help, but seek out a specialist who does specialize in helping peri and postmenopausal women feel normal again.
Yes.
Your gynecologist may or may not want to do that, and that's fine, but there are people out there who can help you.
Absolutely, I'm here.
There you go. All right, well, thank you for joining us, Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thank you for joining us at Health Talks.